Is dementia really preventable? I'm Dr. Ashanthi Gajaweera. I'm a board-certified neurologist and founder of HealthSpan Neurology, a practice where my mission is to help patients minimize the risk of dementia as much as possible. Today, I'd like to talk to you about that very question because it is the motivator of all my work, and it is the question that I get asked most by patients as well as my own family and friends. So, is dementia really preventable? So, as a neurologist practicing for over 25 years, I've had the privilege of working with thousands of patients, and I've often had to deliver really difficult news. Oftentimes, that difficult news was telling someone that they had a diagnosis of dementia, whether it was Alzheimer's, Lewy body dementia, Parkinson's, or vascular dementia. So often they would ask me, Doc, is there something I could have done to have prevented this? And patients are often accompanied by a family member, often a son or a daughter, who is watching mom or dad decline, and they'd be asking themselves and me the same question. Is this going to happen to me, and what can I do to prevent it? And I'll be honest, I told patients what most neurologists would still say, and that is basically eat better, exercise more, and get good sleep. But I always felt like, this is really bland advice. It's not very motivating or encouraging, and yet it's still the standard of care for conventional medicine, even though it really falls so short for such a devastating disease that affects so many of us. So this question is what motivated me to explore whether there was more that we could be doing and what does the data actually show. So I started to explore the research, and I realized that there's really an abundance of evidence in the field of dementia prevention. But like many things within the industry of medicine, dementia prevention is rarely profitable. But in July 2024, a really amazing piece of scientific evidence came out, and that was the Lancet Commission, which is a tremendous multidisciplinary group of international scientists who published their report on dementia prevention, intervention, and care. And this vast meta-analysis, which means they looked at multiple studies across various disciplines and did rigorous statistical work, showed that there is evidence for 45% of cases of dementia being preventable if we could mitigate or eradicate 14 risk factors. So I'm going to share the main graphic from that study because it really brings home the message that dementia is preventable. I'll link to it in my comments as well. Each of the bubbles in this graphic represents how strong an influence a given dementia risk factor has on the overall prevalence of dementia. In other words, if you got rid of that individual risk, what percentage of patients would not get dementia? So I'm going to focus on the midlife risk factors because for the purpose of this study, they considered midlife to be age 45 to 65, and for the purpose of dementia prevention, that's really the golden opportunity that we have in terms of dementia risk mitigation. So the first risk in terms of importance was hearing loss, and that accounted for 7% of cases. High LDL cholesterol, 7% of cases. Depression attributed 3% of cases. Traumatic brain injury, 3% of cases. Physical inactivity, 2%. Diabetes, 2%. Smoking, 2%. Hypertension, 2%. Obesity and alcohol use, 1%. So all in all, if we could remove all these midlife risk factors, we would prevent 30% of dementia cases worldwide, which if we consider how devastating this disease is, that's pretty tremendous. So this is great news if you work in public policy, but what does it mean for you as an individual or for me as a doctor and how I'm advising patients? Because how do we take this information home and apply it into our lives? So what I do in my work in HealthSpan Neurology and what I'd like to do with you in this channel is to teach you my framework for thinking about dementia prevention. And I think a really motivating way to think about this is the same way we think about financial planning, right? You have to start early, you need to set your goals, and you need to know what your timeline is. Once you do that, you look at the data. Where are you now? Where do you want to be? And you figure out the map and the strategy to get you there. And that's exactly what I do. And here's the thing, we have the data in terms of precision medicine. It's available. We just need to know what to look for, where to look for it, and how to interpret it. So stay tuned to my next videos, and the next one I do is I'm gonna try to show you how to build the framework for how to build a dementia prevention strategy and compare it a little bit to financial planning, because I'm hoping that this is a fun and motivating way to feel empowered rather than scared or confused by what can be a really daunting topic. If you're interested in working with me to develop your personalized dementia preventive plan, I'd love to have an introductory call with you. You can check out my website and maybe think about me just the same way you might think about your retirement financial planner. You know, we plan ahead for the future. If you felt inspired to learn more about dementia prevention, I'd love if you'd subscribe to my channel or leave me a comment. It'll boost my ego and it'll motivate me to make more videos just like this. So finally, this information is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or qualified health provider for any questions you may have regarding a medical condition. Never disregard professional medical advice or delay seeking it because of something you've seen on this channel or in this content. I'll see you next time.